So this is a 55-year-old man. He's a construction executive, and he has high blood pressure, but it's poorly controlled. And he's in a business meeting, and he slumped over at the board meeting and had the acute onset of left-sided weakness. And his colleagues there knew he was having a stroke. They called for an ambulance, and he arrived at the emergency department about 30 minutes after the witnessed onset. His Glasgow Coma Scale score was 9, and he had a very high blood pressure at 225/110. And here's his CAT scan. He has a right basal ganglia intracerebral hemorrhage with intraventricular hemorrhage and right to left shift. He has an acute intracerebral hemorrhage, ICH. So the question is, what do you do? And is there evidence behind what we ought to be doing for this patient? Should he have hematoma evacuation? Should we aggressively lower his blood pressure to a systolic of 140 millimeters mercury? Or is this such a bad disease that we should just allow him to pass away due to a poor prognosis? So intracerebral hemorrhage is defined as bleeding into the brain parenchyma that is spontaneous and not due to trauma. It's a subtype of stroke that is distinct from subarachnoid hemorrhage, as well as distinct from isolated intraventricular hemorrhage.